When cancer is causing pain, it's doing it because it is compressing a nerve bundle, some peripheral nerves, some pain nerves. It's blocking a function, and the function is causing a buildup of pressure, or there's different things, but it's all due to a mass effect. It's due to something. It's due to the cancer. So clearly, the way you would really deal with it is to get rid of the cancer, of course, which is what you'd want to do. That's not always the easiest thing to accomplish. But there are ways of dealing with pain. Now, the way that I have found over the years, and you got to get rid of the pain, because if you don't get rid of the pain and you've got chronic pain, your mind is not going to be free. Your mind is not going to be healing. Your mind is going to be in anguish. Your mind is going to, and your immune system is going to be in trouble. So I hear you. But the best thing that I have found is cannabis in very high doses, rectal. And I'm talking a minimum of 500 milligrams 2 times a day, maybe 3 times a day, maybe 800 milligrams twice a day, whatever. Okay, it's got to be extremely pure. I mean, it's purified less than 20 microns. Use filters that are less than 20 microns, less than 10 microns, okay? And do it rectally so there's no psychoactive effect, because you can't take large amounts of cannabis, those large amounts, without getting extremely stoned, and that's not good. You're not happy, no one likes it. Cheech and Chong wouldn't like 500 milligrams twice a day, believe me. It's just too much, all right? So it's way different than taking a hit or two off some sativa to stimulate appetite as an anti-nausea and things like that. Way different than we're talking about. We're talking about high doses for pain. And you can usually get off all narcotics, because narcotics will turn off the bowel. What they do is they stop peristalsis, which makes you constipated, but it also, that's at one end, the constipation. At the other end, you're not able to digest well, you're not able to absorb well, so it destroys digestion, it destroys absorption. So in other words, you're not getting the nutrition from your eating either, right? And the other thing is that these narcotics, these opiates, I don't care what they are, oxycodone, morphine, Demerol, Dilaudid, it doesn't matter what it is. They all lower your threshold for pain. What does that mean? That means that now what was not painful yesterday will be painful today, because your threshold is lower. In other words, you're more sensitive to things, noxious stimuli that causes pain. Right? That's what it does. And then finally, it suppresses natural killer cell function directly. So it's like, what? It's like the worst thing in the world. And it doesn't work. You got to keep taking more and more and more and more until you're dead. But cannabis will get you off that. So you got to do that. And if you're in a state where it's illegal, you got to get out of that state and go to a state where it's legal, or find a way of getting it somehow and get large amounts rectally and make sure it's as pure as possible. Okay? Okay, because remember, funguses I think are 20 microns, so you got to get below 20 microns.